we're going to be talking about a couple things today. I think you probably all saw my medicine cabinet full of all of my good, wonderful skincare that I love, and we'll be going into that later. But first and foremost, I just want to show you I have my tea ready to drink with you, quarantine. So cheers. And I wanted to talk to you first of all about the DiamondGlow aesthetic treatment. So we're really excited about this, this new treatment. It's really the next generation. It's the next level in facial aesthetic treatments. I think one of the things that happens when people come into our medical spa is I think oftentimes people think facials and they're thinking of European style facials, which are wonderful, but it's more about the massage of the creams and everything into your skin and the steam and that. And those are wonderful. But what we do at the medical facility at La Jolla Cosmetic Medical Spa is a little different. We really like to call what we do our treatments. So they're going to be, again, more aggressive. I wouldn't want to say aggressive, but they're going to be more results driven, okay? Not so much about the fluff, but really about results. So what I want to talk to you about today is the DiamondGlow aesthetic treatment. So we're very excited about this particular treatment. Like I said, it's the next generation of facial aesthetic treatments. It is actually a patented technology. So what we'll talk about in regards to the patented technology, I'm going to kind of show you. I don't know if you can see that, but if you see right there, that's actually the wand that the DiamondGlow treatment uses. And when I say patented technology, it simultaneously will exfoliate, extract debris, and also infuse all at once. So it does this all at once to, for pores that are open and ready to receive all of those, all that good stuff. Some of the things that you can expect after having the DiamondGlow treatment are going to be a lighter, brighter skin, more clear, unclogged pores, smaller pores, and more of an even skin tone, just a clarity to the skin. And as you do this treatment, really with any kind of facial aesthetic treatment, you should be really doing it every 4 to 6 weeks to get the best results. So that's when you do it for a period of time, you're going to see a reduction in fine lines and wrinkles. You're going to see a smoother skin tone. So it helps with that smoother texture to the skin. It also helps to hydrate and plump the skin, which is what we all want, right? So what's wonderful about this treatment too is that we can customize this. So, not everyone's skin is the same. So we can't do a cookie cutter type of facial treatment. With this, I had shown you, again, that diamond tip that you see right there. So that diamond tip, there's all kinds of different, some are more abrasive than others. So for someone who has more sensitive skin, maybe you have broken capillaries or what have you, we're going to use more of that smoother diamond, okay? So it's not going to be as aggressive. And then, of course, for people who have more, have more of a problem with texture, we're going to use a more aggressive. And what's great about that is that you may have just mild acne scarring. And I say mild because I think a lot of times people think that facials can, although we can do a lot, that's why we have our other providers who do the lasers and the injectables and all those things and it all works synergistically together. So we can do, maybe if you have some mild acne scarring, we can do more abrasive in this area right here. Let's say as you're getting older, one of the things that happens is we get that orange peel skin, right, on our chin, so we can be more abrasive there. So you can really customize the treatment, which is great. What's wonderful about this treatment too is that it is quick. We know that you are, working women, working moms. We don't have a lot of time, and also working dads. I shouldn't leave you guys out either. But time is money. So this is a really efficient way to take care of your skin. So also in customizing those treatments, we have different serums that we can infuse. So, again, we can do the ultra hydrating treatment. And again, it's going to be just as it sounds. Ultra hydrating, what's that meant to do is to plump the skin, hydrate the skin, as we are, it's more for dehydrated, more mature skin or what have you. So in the winter months, oftentimes we're using the heater, so our skin gets more dry. People who travel for business, which we're not doing right now, so when you get back on those airplanes, this really helps to hydrate and plump that skin up. Let's say that your skin is feeling dull and lifeless. The vitamin C treatment, would be the best one for you. So that's going to help with dull, lifeless skin. It's going to kind of give that skin that clarity, that luminosity, and just really kind of wake you up. So this would be a great treatment when we get back into the medical spa. Another one that we do is going to be the skin brightening treatment. What's great about skin brightening treatments, and one of the things I do want to say is that with all of these treatments, from what Lauren does, what Kara does, what Julia, Khan, Amy, is we all want to create a clean canvas that reflects light. That's really what all these treatments are about. When you have poor texture, large pores, fine lines and wrinkles, you absorb the light, and your skin looks more dull. So what we're trying to do is just take away these imperfections, so to speak. So, no discoloration, help, lessen the fine lines and wrinkles, better texture, smaller pores, because then the light is reflected from your skin, and that gives you the more of the glow. So that's what we're looking for. So with the skin brightening treatment, it'd be just that. It's going to help with that discoloration. It's going to even up the skin tone, which is really helpful and beneficial. It just gives you an overall fresher look. And then, of course, we have the pore clarifying treatment. So more for the oily, acneic skin. So you can really customize these treatments to what is going to work best for you. What's wonderful about it as well, I'm saying the word wonderful a lot, but what we really like about this treatment is that we not only can treat the face, we can treat the neck, the décolleté area as well. We can actually treat the backs of the arms. So if you have those red buffs, that actinic keratosis, that can help with that. The back, if we're going to be getting into summertime, so it's really great for those areas. But one of the things that we're really excited about is that it also treats directly underneath your eyes. So what's great about that is that oftentimes, when you're doing any kind of treatments, you really, again, the facial treatments, you can't really get up in here. So what's great about that is that you're able to really get in there and plump up those areas and hydrate those areas. We also are going to do the brow bone too, kind of exfoliate that area and plump that area up as well. And then what we're really excited about is we're going to do the lips. So oftentimes our lips are dry and dehydrated, and it's I'm always getting asked, what can I do for my lips, Cameron? This is great because it's going to actually exfoliate the lips, but also hydrate and plump those lips up as well. So it's a really wonderful treatment. We're very excited about it. A couple of things that's great about it too is that DiamondGlow was actually purchased by Allergan. So you can use your Brilliant Distinction points. You can get Brilliant Distinction points for having the treatment done as well. So there's going to be a lot of great specials, and we're very excited about the treatment. Do I have any questions about that?
So far we just have "You look gorgeous" from and Marcella loves you. So Cameron, what are the I remember them telling us there's like 3 or 4 different versions of the DiamondGlow, like the serums that you can infuse, right?
Yeah, those were the treatments that I was talking about. So you have the ultra hydrating, so it's more for that dehydrated skin. You have the vitamin C, which is going to help with that dull, lifeless skin. This is a great entryway, that dull, lifeless skin. So the vitamin C. You're going to also have the pore clarifying for the more oily, acneic skin. And then you have the skin brightening. So you have 4 different treatments. So we can mix those up as well. You may come in one week to do the vitamin C. Then you might feel that you're dehydrated or what have you. One of the things I also want to say is that this is a great treatment for everybody. It's for all skin types, all ages. This is a great entry treatment for, those 20, 30-year-olds, 40-year-olds. This is a great start out treatment. And so.
Okay. And also then we had, Kathleen's asking which facial treatment is best for menopausal skin.
Oh, menopausal skin. I get you. Believe me. Those, you young girls who are out there, you haven't come across this yet, but you will. Um, so menopausal skin, there's so much that you need to be doing. Oftentimes menopausal skin is dry, dehydrated, lifeless, all of these things. So a good at-home protocol is really important because that's going to be on a daily basis. But as far as it really depends on what you're experiencing. Are you experiencing poor texture? A lot of postmenopausal women, though, it's more of the dehydration. So I do like this treatment, the ultra hydrating treatment, the DiamondGlow. We also have the Hydra Facial, which is a great treatment as well. So you really come into our office, you would meet with us, we talk about and really take a look at your skin and kind of go over a treatment plan that's going to be more specific to you and your needs.
Is it something that they could, like you mentioned, Hydra Facial, where they might do one DiamondGlow and the next month they could do a Hydra Facial, or do you like to keep it kind of the same?
No, that's absolutely it. Just again, Monique, what it's going to do is it really depends on what the individual's goals are. Let's say I have someone come in and says, I really want to work on I really want to brighten my skin. I this discoloration, this melasma. I would we would probably gear towards the skin brightening treatment from the DiamondGlow, and also we have the Oxygeneo, the Neo Bright. We could also incorporate, and I would put them on a skincare protocol, and maybe we incorporate doing peels in there as well. So there's just so many different ways to achieve what we want to achieve. It depends on the individual's ability to have downtime, because sometimes it's really hard for people. So doing peels might not be what you're going to be doing. But a lot of my patients, what we do is we'll go back and forth between Hydra Facial, DiamondGlow, Oxygeneo, peels,
Uh-huh.
so we mix it all up. And then also we want to look at doing things with the providers, Julia, Kara, Lauren, Brittany, Con. So maybe incorporate some microneedling. We all work together just to really get the best result for you.
Awesome. Okay, we have a bunch of more questions. Okay, so what Aunt Ria says, what treatment is best for someone who is 70?
Oh, Aunt Ria, you're so funny. It really depends. I mean, 70 nowadays is not like 70, 30 years ago. So it really depends on how you've taken care of your skin, what you want to do, what your goals are. But starting off with any of these treatments would be great. I do like the DiamondGlow. Maybe the ultra hydrating treatment would be good, or the vitamin C. I think that's a really great way to start off with that.
Chrissy asks, what is the best for teen facial acne or on the back? Is this too aggressive for young skin?
No, it is not. It's not too aggressive. And what's great about it is that, like I said, because of with the diamond tip, again, I'll show that to you. If it depends on what kind of acne they have, if they have very, pustule or what have you, we probably want to be really gentle with that. You don't want to irritate that. And, one of the things too is that if someone has it on the back, we could try a couple treatments, but oftentimes when you have acne on the back, it's really hormonal and something that's going on internally. So, you want to look at all avenues to really take care of that. But you can do the DiamondGlow on the back. We can do the Hydra Facial on the back. We can do the Oxygeneo on the back. So everyone is different. So it's important for us to really, be able to see you and talk to you and see what's going to work for you. But teenagers also, what I like to tell them is take a shower, because sometimes they don't always do that. So especially the boys, right?
Yeah, for sure. They don't why would I need to wash my face before I go to bed,
Exactly. Yes.
Heather asks, what treatment or which treatment would you recommend for large pores?
Oh, so for large pores, I am going to tell you that oftentimes your pore size is pore size. But what I will tell you is when you're doing facials or facial treatments consistently, it does help with pore size. I know that Monique, when I know that we did a DiamondGlow on you.
Yeah.
And one of the things that you mentioned was that we saw an immediate change with your pore size.
Yes.
So, again, I think that it just depends on how consistent you are. But I would say that the DiamondGlow, I really am liking the results in regards to the pore size for that. But I will tell you, like anything, and I tell people that you can't go to the gym once and expect everything to be great. God knows I know that. But I think that it's really important to be consistent. And I know that out there's a lot of smoke and mirrors to facial treatments and products. It's just, being consistent.
Yeah, that's so true. So one other question before we get into, well, mostly actually both of the questions now are asking about products.
Oh,
so
good.
I'll let you talk about products,
Okay.
and then we'll answer the questions that we have coming in about products, but I'll let you talk about your faves first.
Okay. Thanks so much. So now we're getting into the products, and anyone who knows me knows that I do love products. So first I was going to invite you all in and have you take a look at my medicine cabinet, but it was too much moving around, and anyone who knows me knows that I'm not so tech savvy, so I wanted to kind of be stationary. So you can go on to the Instagram account and you can take a look. I walk you into my bathroom, I show you my medicine cabinet, and it is, as my family would say, too much. But I'm going to take you through my nighttime protocol. So I think that with skincare, I talked about it being really a lot of smoke and mirrors. There's a lot of advertising and marketing that goes into skincare. The skincare industry is a multi-billion-dollar industry. 7% of that is medical grade. Why do I think medical grade, I mean, not only myself, but many others as well, medical grade product, when you are in a doctor's office, doctors require white papers, which are clinical studies on all the lasers, on all of the injectables, on everything, and all the skincare as well. So you actually have clinical studies that show that the products work. Which is really important. A lot of these products are also written up in the cosmetology periodicals and cosmetic derm periodicals and things like that. So it's important that you have that backing. I also want you to know that what a lot of people will not know, they don't know the name brands of a lot of these medical grade products. And the reason why is because they do not advertise to the public. Their money is spent on research and development. Okay. So I do have, I remember my grandmother only wanted to use Chanel products because they were pretty packaging and they all matched together. So that's not what we want to do with their skincare. But I'm going to go through my nighttime regime. And, there's 5 things that you really do need for a good skincare protocol for preventative. And I want to talk about being preventative, okay? Because a lot of people will say, I've used this for 2 weeks and I don't see a difference. What you do today is taking care of the woman that you're going to be in 10 years. So it's preventative and it all works together. So when I come home, I of course wear makeup during the day, and I like to actually use, and I can't really see my screen, but I actually use a Covergirl makeup remover, which is just for my eye makeup. And of course the cotton pledgettes, which are really important, just gently doing and taking my eye makeup off. And so I start out like that. Then I will do a double cleanse, especially if I'm wearing makeup, because you want to get that makeup off. It's just important. I really do like the Elastin cleanser. It's very gentle. It doesn't strip your skin, but it's really great about getting makeup off as well. So you want to go through and do a gentle, a quick cleanse, and then really, you might have to double cleanse if you have the makeup on. One of the tricks I will tell you that I do is I love to use a fresh new washcloth every time I wash my face. But I like the thin ones. I don't like the thick ones. And I have to tell you, I get my washcloths at Walmart. They come in a package, all white, and they're thin, and they've got they're, have a little bit of exfoliating. I mean, they're a little texture, so, which is nice. So that's one of my tricks. So after I do the elastin, what I will do sometimes is I love these pads. If you have not tried these are the SkinMedica exfoliating pads. So this is a retinol. You do this all over your face. What I like about this too is I actually do it right underneath my eyes as well. We do have some area right in this, again, that we want to get improvement in. I would not put this on my neck because our necks are really kind of delicate, but I do put it on my décolleté. So I use one of these, and I do this probably 3 times a week. So I would do this right after I cleanse, and then I continue the rest of my protocol. So here's my heavy hitter. If you know me, you know I love the TNS Essential Serum. So what's wonderful about this is one of the products that I call a heavy hitter because it actually does multiple things. So with the TNS Essential Serum, it actually is a dual chambered pump. So you can see, again, what I have, how it has the 2 different pumps at the 2 different sides. So the red one is 93.6% pure human growth factor. So this is going to stimulate collagen and elastin. And why is that important is because, that's what we want. The elastin is going to give our skin that elasticity, the bounce back, okay? And then on the other side, it is a combination of potent antioxidants. It has peptides, and it also has hyaluronic spheres that plump the skin. So what's wonderful about this is that the antioxidants are going to protect the collagen and elastin, okay? So this is I never want to waste this stuff. And you should always do your face, neck, and chest when you're doing the TNS Essential Serum. Actually, really important, okay? After I use that product, I think it's really important to have your skin be all one tone. Remember, I talked about the fact that you want that luminous, that you want that glow. It's all about keeping it even toned. So I like the SkinMedica Even Tone. And this helps with browns, helps to even out the skin tone, lighten and brighten. And those are, a lot of people will do treatments where they get an IPL for the dark spots, or they do a halo for the dark spots, or they do a peel, but they don't protect their skin and they don't use something in the, afterwards. So it's really important to do that because what it's going to do is that actually suppresses the melanin so it doesn't come back, so you're protecting your investment. So after I do the SkinMedica Even Tone, I also like the SkinMedica Alpha Ret. So this is a retinol, and retinol's one of our quote unquote food groups, okay? So what retinols do is they help with cellular turnover. It's going to help slough off the dead, dry, dull skin cells, pushing your new cells up to the surface, giving your skin that glow. Really important to use. Now, a lot of people, when I say retinols, they think of Retin-A. And they remember how when they were younger and they used Retin-A and it made them red and flaky, and they had a really bad experience with them, irritated. That's not what you're going to have when you use something like SkinMedica Alpha Ret, or SkinMedica has a retinol as well. What you're looking with medical grade products too is the delivery system. What does that mean? So that means that this is actually a Retin-A that's encapsulated. It's actually going to bypass the epidermis, get to the dermis, and it's going to time release. And why that's important is that you're not going to get red and flaky. Retin-A will release all at once when you use the prescription Retin-A. This is time release, so you can use it every night. Also, with Retin-A, you have to stay outside of the orbital rim. With the Alpha Ret, you don't have to. So I go right up inside here, okay? Now, I know a lot of people get confused because it says overnight cream. I need more moisture. You may not, which is fine. So that's why, again, doing a skincare protocol that works for you is going to be important. So, but again, retinols, you want the biggest bang for your buck, you start using a retinol. After the retinol, talking about the postmenopausal skin, of which I do have, and because I did go through menopause, and your skin does get dry and flaky, okay? So I love the HA5. So this is the SkinMedica hyaluronic. It actually should be HA7 because it has 7 different molecular weights. So it sits in different areas of your skin and it plumps the skin up. So when people are talking about them, I feel dry, I need to get a better moisturizers. Moisturizers really just seal in the moisture already in your skin. They don't necessarily bring moisture to your skin. So that's what a hyaluronic does. And when people come to me and I put together their protocol, they'll always hear me say, I want you to do it with a spritz of water. So hyaluronic acid is hydrophilic, so it's attracted to water. So I have them do a little squirt here, and then I have them take like any kind of like, you can use a spritz bottle from Evian or what have you, just a couple sprays, and then kind of mix that all up and then put it on. It will just go on much more smoothly. Okay, so that's what I mean by spritz of water. And you can get, the little spray bottles by Evian that you can get at any of the drugstores. So after I do that, I do a moisturizer. A lot of people use that hyaluronic as their moisturizer, and that's fine. For more acneic patients, that's what I will do. But for myself, I like a lot of really luxurious creams. So right now I'm using the Elastin Nourishing Moisturizer. So I use this all over my face, and I've just been treating my face. The one thing I do for my neck and chest is I also do this face, neck, and chest, okay? So after I've done that, we're not done yet, friends. We're not done yet. I'm a big proponent about the neck and the décolleté. The reason why is so oftentimes you will see women whose face and neck look like a different decade from their chest, right? Because it's pigmented, it's a mess. This area is so important to take care of. So I love the NeoCutis Microfirm. So this is for the neck and the décolleté. It's going to help to firm up this area. Really important to do. You want to make sure that you cover this area as much as possible as well, because we get a lot of incidental sun in this area as women. And so we just want to keep it covered. After I do that, I'm not done yet. The eye cream, I know that Amy talked about this eye cream, which is the Instant Bright, which I really like. I will teach you one thing with the eye cream. You want to make sure you just need one pump, as I've done here. You use your ring fingers, just like this. And the reason that we use our ring fingers is because if you use your pointers, your pointers are a lot stronger. You want to be really gentle when you're going in here, right? Really, really gentle. So also the eye cream. And then last but not least, I always end with Latisse. So when you get your Latisse, it comes with how many brushes? It's unbelievable.
Like
Yeah.
30 or 60 or 90. It's ridiculous.
Yes. Get rid of those brushes. And what you want to get for yourself is get yourself a little skinny eyeliner brush, okay? Because what the directions, I believe, tell you that you should do the drops on the brush. I don't know how you would do that. That is crazy to me. But you just take your Latisse, unscrew it. You drop 2 drops in, boom, boom. And then what you do is just take your little eyeliner brush, put it in there, and then you're just going to do it just like you would liquid eyeliner, just like that. One of the things I do too is I love a good thick brow. So as you get older as well, you lose those eyelashes and those brows. I also use a little bit up on my brows as well. So I will tell you that I switched my skincare around. I have different collagen stimulators that I like. There's a Elastin product that I love for that. There's NeoCutis Bio Serum Micro Serum. And you'll have people in our office. I know Diana, who's up at our front desk, who's magnificent. She loves the Micro Serum. I do know that Amy loves Skin Better. So we all have our favorites, and everyone at the office can help you with any questions you have about skincare. So.
And speaking of questions, so we have a
Yes.
lot of questions to get through.
Okay.
One, Brittany asked, is the order of application important?
Yes, it is. It is. And I will tell you too that everyone is not everyone, but if you want an easy way, you want to think thinnest to thickest. That's the easiest way, but you do have serums that are kind of thick too. But yes, the order does matter. And what I also will tell you too is that using certain products twice a day matters as well. You want to use your collagen stimulator and elastin stimulator twice a day. You want to use your lightener brightener twice a day. You only need to use your retinol at night. So a lot of people will tell me, well, I'm trying to budget, so I'm only using it once. I would rather you just treat your face and do your face rather than skimp, because you're not going to get the results.
Yeah, true. Okay, one person asked, Allie asked, what products can you recommend postpartum? It's been a while since using my regular routine. How do I bounce back?
Are you I guess the first question would be, it depends on if you're breastfeeding. We, you know, my goodness, I think since I started being with Jolla Cosmetic Medical Spa, I've been around for like 6 babies or 4 babies, or I don't know. So we have a lot of, we definitely that we know what to do for postpartum skin. It really depends. So if you are breastfeeding, you are limited. Okay, you are limited. You don't want to do any retinols, and you don't want to do any like hydroquinone. Hydroquinone is the gold standard for a lightener brightener. That's not what you would want to do. But you could use an antioxidant. That would be good. The micro serum. So I would say, you know, again, I think that the way to really lighten your skin up, I would use the vitamin C. I think that would be one of a really quick way to get your skin back in shape, so to speak. And once you stop breastfeeding, get back on that retinol.
Okay, awesome. Tracy's asking 2 questions. One is, what is your favorite sunscreen?
Oh, so I love LTMD sunscreens, and I love, they have all, I mean, if you know LTMD sunscreens, basically they have so many different sunscreens for every different occasion. So I do use I like to use a tinted sunscreen on my face and my neck, but you got to be really careful. So I have a different, like I do love the LTMD UV Pure for my décolleté, because I'm kind of very protective of that. I do love the ones that have zinc. It's really important to have zinc in your sunscreen. And I think the biggest thing though too is to reapply. Most people don't reapply their sunscreen, and that is the biggest, you know, the biggest problem. When you're out and about, you really want to make sure that you are reapplying your sunscreen every 80 minutes. I would say LTMD sunscreen. There's some great sunscreens that are over the counter as well. At the drugstore, you can get La Roche-Posay, which is actually a product that's from France, and it has Matrexol. That's a great product. They have great Cetaphil, CeraVe. So the big thing is to get it and use it and reapply with your sunscreen.
And I'll just interject on that one too,
Sure.
because with the reapplication, I know for somebody like me, once I put my makeup on, then I'm like,
Yeah.
well, how the heck am I going to put a liquid sunscreen? And so for that, then I use the Color Science, the brush.
Yes.
Because then it's like a powder. It's a powder mineral sunscreen. So for somebody who is like, I don't want to mess up my face.
Well, exactly. And I think that, you know, I did my nighttime routine. Maybe next time I'll do my daytime, but I always have the Color Science. I have brushes all over. So I have one in my car, I have one in my purse, I have one in my makeup bag. It's really important. So let's say you put your liquid sunscreen on in the morning, regardless if you use the Color Science powdered sunscreen, you should still start with a liquid. Okay, so you start with a liquid, but let's say that you're going to go outside for lunch. Well, how are you going to reapply when you have full face of makeup on? With the Color Science, it's really simple and easy. You just go ahead and do that. And one of the things, as we get older, ladies too, I don't like that matte look. So I would take a spray and just set that, and you have more of a dewy look with your sunscreen with the Color Science powder.
Oh, I love that. I love that. I've noticed that if I use the Color Science, it is sort of matte. So that's a great idea.
Yeah.
So Tracy's other question was, is a peel safe for someone with broken capillaries and discoloration, and she's in her early 50s?
Yeah, absolutely. Not a problem at all. You know, it depends. So for example, there's a couple thoughts on for someone who has broken capillaries. So broken capillaries and rosacea are two different things, but there's two schools of thought. A lot of people think that doing peels on rosacea is good because it gets the blood flowing, and other people think it isn't. So it really depends on what your goals are, how bad, not how bad, but how many broken capillaries you have. But yeah, absolutely. Peels are good for everyone. And we don't really do really, really deep peels like we did years ago when doctors would do peels. And the reason why is because you cannot control the acid. You can't control how deep it goes. That's why you have, you know, the providers who do the laser, because you can control to the micron how deep that goes. So yeah, anyone can do peels.
Great. So for people, this question, for people on a budget, what are your essential product choices?
So for people on a budget, so the essential product is I would do a big hitter. I would do either a TNS Essential Serum, Elastin Restorative Skin Complex. I would do one great product, or also a retinol. So I think that, and it just depends on what your biggest concern is. But I would do one heavy hitter, or I would do a retinol, because retinols, you see a lot of improvement.
Okay. So Kathleen says, and this is just a comment, not a question. K Beauty, because you were talking about, you know, your big lineup at night and how many products. She said K Beauty is so 2018. 2020 is all about C Beauty, which is Cam Beauty.
Oh my gosh.
Which we love.
And let me just say too, I know that my protocol is not for everyone, but we all, you know, I've been doing skincare. I mean, I think I started using Clarins when I was 13. I've been using all medical products since I was 25. And I love it. So when someone comes in and they want to start a skincare protocol, I'm going to look at what they're currently using. And we're not going to go in and say, okay, now you've got 12 products you're going to use. No. What we like to do is we like to start you off one by one. You tell us what the main concern is, and then we address that concern specifically. Have you used that for a couple months? See the change? And, you know, we do it slowly. I know a lot of times when you go to a department store, you love the sales girl, so you buy everything. You get home and you're like, well, what did I do? How do I use this? That's not the way we like to do it. So we want to see what works for you.
Perfect. And then the last question, Diana said, what is the best facial and skincare product for brightening the skin or have stubborn pigment?
Stubborn pigment is it's so difficult. I know. I will tell you that, you know, being consistent is really important. So in regards to the best facial, I will tell you something with stubborn pigment, peels are really the best thing for that. Or, you know, and I'm talking about in my wheelhouse. So peels are really the best thing to do in my wheelhouse. But again, and using product at home, using the hydroquinone, using retinol, using lighteners, brighteners, being really consistent with your sunscreen. And as far as I would say the DiamondGlow skin brightening treatment, and also the Oxygeneo Neo Bright is a really good treatment too, but it's about consistency as well. And it really, really is so determined on you know, the patient's, their commitment.
Right. True. Okay. Well, thank you, Cameron. So I'm going to stop sharing your camera, and let me see here. Stop.
Can I say goodbye to everyone?
Oh, of course. Whoops. Wait.
Oh, okay.
Are we popping back in? Sorry.
No, that's okay. Am I on?
Yes, I think you're on.
I just wanted to say thank you so much for everyone who came and showed up and supported us. And just like I said, we miss you guys very much, and we can't wait to get back to taking care of you. And thank you for joining me today.
Yeah, and so I'll show everybody. I'm going to share my desktop and just let you know that we do have virtual consultations, and we would love to have you join us for a virtual skin consultation, or if you're thinking about a surgical procedure or you know, something that we do up in the med spa, you can feel free to call or text us at 858-452-2066, or email us at lookgreat@ljcsc.com. And you could also text GLAM to 452-2066 to get on our text message list. So you have to put in the area code there, but text GLAM to 858-452-2066, and we'll send you information about, you know, when we're getting back to business in the office, about any specials, which we do have quite a few product specials right now. And you can go to shop.ljcsc.com, which is our online store. But if you want to sign up for the text message list, then we can send you those specials in a link. And we thank you for joining us. And we have more coming up next week, which we'll be sending out on Monday. We'll send out the schedule for those next upcoming Spill the Tea quarantine seminars, and we look forward to you guys joining us then. And in the meantime, have a wonderful weekend, and have stay safe and stay healthy and stay inside. So thanks all, and we'll end the meeting now. Thanks. Bye-bye.